Start with your reaction on the latest adjustment to restrictions by the president. Could he have done more, or are you happy with what he's announced so far?
I think we have to make sure that wherever we are, we implement non-pharmaceutical interventions, and that we continue to wear our masks, social distance, and make sure that we invent well-ventilated areas. We know how to prevent getting COVID, and we know how to prevent spreading it, and we need to continue to implement those interventions. So whether we're in level 3 or level 1, our behavior should be the same.
Let's talk then, Professor, about the clinical trials that you have been running, the Johnson & Johnson clinical trials. How far have you gone inoculating the health workers, and how much do you still have to go?
So sure, we have approval to inoculate up to 500,000 healthcare workers with the J&J and the Sisonke study. And we are halfway through this process, and we hope to continue rolling it out and finish our vaccination program by the end of April, just in time for the rollout of the general rollout. And so this is important. This was an interim measure to make sure we could get to as many healthcare workers as we had vaccines for in a period before the third wave.
Yeah. Are you disappointed that by today the deadline, or should I say the commitment, was that about 1 million health workers should have been vaccinated?
Well, we only have 250,000 vaccines in the country, and so I'm very happy that we've managed to get those vaccines to the healthcare workers. We have another 70,000 that will be executed in the next 10 days, and then when we receive our last 200,000 batch on Saturday, we'll be able to do the last 200,000 healthcare workers. And so we only have that amount of vaccine in the country, and that's gone incredibly well. So I'm incredibly proud of the work that the study team have done to execute this. The teams have been working 24/7. It's a lot of hard work for research staff. They have other work to do, and they've put away their other work to make sure that they can be there to vaccinate healthcare workers in the Sisonke study.
When do you hope to conclude the program, Professor?
We hope to conclude it by the end of April, when the last 200,000 doses come in on the 10th. We will then distribute them, and we hope to penetrate more rural areas, Eastern Cape, Northern KwaZulu-Natal and Southern KwaZulu-Natal, as well as some of the areas in the Free State.
Yeah, you mentioned the Eastern Cape, you mentioned KwaZulu-Natal. There has been some criticism that health workers there remain exposed to this virus because the inoculation process has not reached them yet, and there doesn't seem to be a concrete plan to get to them anytime soon. Your thoughts on that?
Well, I'm not too sure who said there's no concrete plan. We meet every second day to plan the execution of the trial, and we obviously have 31 research sites that have to be spread over the whole of South Africa. And so we basically move from site to site, and we open and close sites as we have capacity. So the trial is going very well, and there's huge expansion into the rural areas. We're in 71 sites. We're in rural areas in KwaZulu-Natal, in the Eastern Cape, and in Mpumalanga and Limpopo, as well as the Northern Cape. So we have moved very rapidly to help with the rural sites. And so I think it's not true that there's no planning. There's incredibly good and fastidious planning.
All right. So how much ground have you covered then, particularly in rural parts of the 9 provinces?
If you have a look at our program, of the 250,000 healthcare workers that we have vaccinated, 10,000 have been, 20,000 have been in Gauteng, and you can see by our graphs that we've spread right out. We're in Kwakwa, we're in Dundee, we're in Ladysmith, we're in East Mthatha, we're in Paarl, we're in Worcester, we're in various parts of Mpumalanga and Limpopo. So there has been huge breadth and penetration of our vaccine program into the rural areas where the healthcare workers are.
Yeah. Professor, the president last night talking about the 30 million, 31 I think to be exact, million Johnson & Johnson vaccines that are going to get to the country. Are you aware of a firm date as to when these will arrive?
Well, I saw on the television last night that he said that the program will start in mid-May, which means that the vaccines have to be in the country before that for the process that has to occur around the validation of the vaccines. And so it seems that mid-May is when the start of the rollout of the J&J program will start, as he announced.
All right. The plans by government to inoculate 67% of the population in order for us to get a herd immunity, Professor, that target is obviously going to be missed now, and the Minister of Health admitting as much. There are new plans, though. Phase 2, which is the phase that we are going to go to next after the health workers are done. The ambitious target there is 13 million people will need to have been covered by November. An ambitious target, or one that you think will be met?
I think it will be met. I think it's important to know that there are lots of benefits of vaccination besides herd immunity. There's the individual benefit. If you get a vaccine, it'll prevent you from dying and reduce your risk of going to hospital. So that's the first thing. So whoever gets the vaccine is going to have individual health benefit. There's also public health benefits, because by vaccinating people, we reduce people going to hospital and we reduce the impact and strain on the health sector. There's also economic benefits. So the more people who get vaccinated, the more we can keep our economy open. And so there'll be lots and lots of benefits of vaccination before you even get to herd immunity.
All right, so I take it then you agree with the following vaccine campaign after the second phase, and that will be phase 3, 22 million by 2021 to 2022. You just as confident?
I think that once we understand the bottlenecks and the issues that slow us down, you can address them. If we have mass vaccination programs, we should be able to vaccinate 10,000 people a day in a big stadium. And so I do think that what we have to do is we have to look at how to do mass vaccination programs as well as individual vaccination programs. So you want to make sure that you're rolling out to sites that not only are doing 50 a day, but can do 2,000 a day up to 10,000 a day. And the more sites we have that can do 10,000 a day, the quicker we can get to our numbers.
Yeah, final question to you, Prof. It's got to do with the Pfizer vaccine. That Pfizer vaccine, it would appear that there is no clarity as to its efficacy, in particular on the variant that has been discovered here. What do you know?
So whatever we roll out, whether it be the Pfizer or the J&J, one needs to make sure that you're monitoring breakthrough infections and you're getting real-time evaluation of the vaccine. And part of the regulatory process for the Pfizer rollout will be to assess that there is field-level effectiveness, and that can be established quite quickly. And so I think it's very important whether it's the J&J study, we need to make sure that whatever variant is emerging, there's efficacy, and whether it's the Pfizer or the Sputnik or the Sinopharm, is that there's real-time data on efficacy so that the government can pause the rollout if it's showing that the vaccine is not working.
So it's not known, therefore, right now what the efficacy of that Pfizer vaccine is, particularly against the variant that's been discovered here?
One will have to evaluate. The trial that evaluated the efficacy was conducted all over the world, including South Africa. There was 800 people enrolled in South Africa. We would have to see what that data showed with the variant emerging. A lot of that data came out before the variant emerged, and so I think it's very important that we establish the real-time efficacy of all vaccines that we roll out in the country.
Professor Glenda Gray, thank you very much for your time.